Hey everybody, Dillon here, back with another episode of Dillon's Diary. Today I have two very special guests, starring in a number of exam rooms in Madigan Pediatrics Clinics. Ladies and gentlemen, please welcome Dr. King and Nurse Kirsten. Welcome, welcome.
Hey, thanks for inviting us, Dillon. We're feeling pretty special to be here and excited for the interview.
How have you guys been?
We are well, thank you. We are just preparing for summer, and you know what that means, a lot of school physicals, regular checkups, and a lot of education on the importance of sunscreen.
Awesome. Yeah, the sun is no joke, guys. So I got a box from the Madigan Army Medical Center, and I was hoping you guys could help me with my unboxing video.
Yeah, absolutely. Let's see what you got in there.
But before we get to the box, I did want to address something from my last episode, Momspiracies. It's for real. They know everything, they hear everything, they see everything. I don't know what special language they speak to each other, but my advice is just listen. It makes life easier. Trust me. Am I right, Doc?
No comment.
See? Okay, let's unbox. We have the cold thing that Doc's put on our chest.
Oh yeah, I have one of those too. I like mine because it's little for little kids. So that's what we call a stethoscope. You know, you'll see your doctor and nurse usually wear one around the neck. And, you know, we listen to the heart, lungs, and anything else we want to listen to, I guess.
What sounds do you hear when you put it on our chest?
Oh, on the chest, it's usually just a heart beating, just like lub-dub, lub-dub, lub-dub. And sometimes we hear a little whooshing sound, which can mean sometimes there's a problem with the blood flow, or it just means there's just a kind of fast-moving blood, and it can be normal.
So that's why you guys ask us to stay still and just breathe?
Yeah, exactly.
Okay, that's cool. Let's see what else we have. We have a popsicle stick.
Actually, Dillon, that's called a tongue depressor. It really does look like a popsicle stick, but these tools help us move your tongues out of the way so that we can see your tonsils and inside your mouth and your throat.
Yeah, this has been used on me. How come sometimes when this is used, I gag sometimes, like I'm choking?
Yes, well, it is natural for the tongue to stay back at the entrance of your throat to protect you from accidentally swallowing things you shouldn't. The tongue is also used to push food you eat back into your throat, so the food can make its way to your stomach. When the parts of your body are forced to do things that aren't natural, like pushing your tongue down and move it out of the way, it's pretty common for you to have to jerk back or feel that coughing effect.
I see. So what do you look for when you get our tongues out of the way?
We're looking for any swelling in your tonsils, and there's also a thing that hangs in the back of your mouth. We also look for any sores in your mouth, and sometimes when you cough, it might hurt to swallow. That just means that there might be something going on with your throat. Tongue depressors help us to see what issues might be.
What's next? It looks like we have a pressure cuff.
Yeah, that's right. So that's the blood pressure cuff. So it kind of goes around your arm, and you feel like a gentle squeeze as you're puffing that up like you're doing. And sometimes you'll see us using the same stethoscope that we talked about before with the cuff. And it's connected to this machine that helps puff it up, and eventually it gives us all those numbers that we look at. And those numbers tell us how well the blood in your body is flowing. If the number is really high, that means your heart is working extra hard to pump blood through your body, which is something that might be a concern concern to us. You know, if the numbers are low, it can mean that your blood in your body isn't flowing like fast enough or well enough, and that could be issues. You know, it cause issues with vitamins, you know, nutrients, oxygen, like carrying, and just issues all over. But that squeeze can be a little uncomfortable, but in a few seconds it goes away, and it's really important that we get it. So we love it when the patients cooperate.
So when my mom says that I make her blood pressure rise, does that mean that I'm making it go faster?
No comment on that, I guess.
Let's see, what else do we have? Oh, the ear thingy.
Yes, that is called an otoscope, and we do use that to look into your ears.
Are you looking for earwax or?
Sometimes, but mostly we want to see into your ear canal. There's a tiny little magnifying glass, as you can see there, in every otoscope, so we can see way back into your ear and find out if you have an ear infection. Sometimes there's fluid that can build up in your ear.
Yeah, I've had a few ear infections as a kid.
Those can be very painful and sometimes cause a lot of issues. The reason that we use the otoscope is the doctor can look into your ear canal to determine if you have an infection. That way the medication can be prescribed and you can be treated.
So it looks like we have some rubber gloves.
We use our gloves when we're in the doctor's office. Usually we'll wash our hands first, so we prevent germs, but sometimes we'll use the gloves too. And we need that so we can when we're examining your throats or anywhere else that might have germs, that we don't pass it on to another patient that we'd be seeing.
So what are you guys feeling for when you rub our stomachs? I remember when I was a kid that you would press on my stomach and then use the tomahawk thing to pop my knee.
Yeah, so we're not rubbing the stomach. We're trying to feel if the inside of the organs that are inside your stomach area feel normal. And we as doctors, have practiced a lot of feeling your stomach, your liver, and the other organs inside, and we know what it feels like. So we just try to give special attention to make sure each area feels normal to us, and then we check if you guys have pain, and then that way we can treat you appropriately with medicine or whatever. And as for the knee, that tool is called the reflex hammer, and sometimes it's called the tomahawk hammer actually. And we use this to make sure that your nerves in the body are sending signals in the right way. And yeah, sometimes it makes you kick out your knee like that. But we test a lot of different areas to make sure your nerves are working right.
Wow, I see all these things when I have my doctor's appointments, but I didn't really understand what they were all used for. This was a pretty cool unboxing. Thanks so much for joining me.
Yeah, thanks for having us.
Thank you so much, Dillon.
Join me next time on Dillon's Diary, when my special guest will be showing us what to do if your baby sister swallows a Lego or if your baby brother eats a frog. Thanks for joining me. Dillon out.